You were discussing with Senator Capito the horrific issue of police being targeted and also suicides. As I'm sure you're aware, there's no comprehensive national data collection regarding police suicides. So in FY 2020, we directed the Bureau of Justice Statistics to maintain a data set and report on police suicides for federal, state, and local law enforcement. Unfortunately, BJS has not moved forward on collecting this data. We provided stronger directives as well as $3 million for that data collection effort in the FY 2021 bill, but still nothing. So were you aware of the delays with this project, and what can we do to try and collect this data? Because it's, as you know, it's really critical to figuring out how we respond. We need to have information so we can think about what we can do to address what is becoming more and more of a challenge nationwide.
I am aware. I understand that BGS will be submitting its report within the next couple of months. I'm not sure exactly how many months is it. In about 8 weeks, I'll have an update for you on this, on where they are on this.
Good. Well, I look forward to getting that. And sadly, we've had some high-profile suicides in New Hampshire. And I also look forward to working with the department on what we can do to address the challenge of suicide within our law enforcement agencies. So thank you. I'm pleased to hear that we should expect something soon. Unfortunately, I missed a couple of the discussions around what's happening with fentanyl because I had to step out. But I know that on Thursday, the administration released their national drug control strategy. Like so many states, New Hampshire is one that has had way too many overdose deaths because of fentanyl. And I wondered if you could give us a little insight into how resources are being shifted within the department to respond to that strategy, and how that might impact small states like New Hampshire, which are struggling with this challenge.
Yeah, so of course, we have been involved in the development of the strategy, and in the most simple form, there's two sides to this. There's the enforcement against the drug trafficking organizations, and there's the health challenges for those who are addicted to try to get them off of the addiction and to take care of them. So on the drug trafficking side, we're asking for $9.8 billion across DOJ to counter drug trafficking. The principal agency for us, of course, is the DEA. For $3.1 billion, which is a $102 million increase for counter drugs. Fentanyl is at the very top of the list of the concerns. When I was at the border, I saw the same problems that everybody else is reporting. These are very tiny pills, and as the DEA administrator makes clear, one pill can kill. And the odds, it's like playing Russian roulette because some of these pills are overdose pills. So that's an extraordinary part of what we're doing. We've asked for money for marshals and for the U.S. attorneys and for the FBI. The FBI is particularly targeting fentanyl and opioid trafficking on the dark web. And as we announced within the last 2 weeks, we took down the largest dark web drug marketplace to prevent the way in which some people are getting it, which is online at this point. So there's a number of different things here. Criminal Division has money in the budget for the regional opium strike forces. And then there are COPS grants under the COPS program for anti-heroin and anti-meth task forces. So that's on the enforcement side. On the overdose addiction side, we've asked for $418 million for the Comprehensive Addiction and Recovery, the CARA Act grants. We've asked for $190 million for the COSAP program, that's Comprehensive Opioid Stimulant and Substance Abuse grants, and another $75 million for mental health and substance use grants. Money for drug courts, $95 million for veterans treatment courts, and for our consumer protection branch, which tries to stop those who are oversubscribing and improperly over-dispensing opioids. So it's a, it's a two-pillar issue here for us. I can't think of anything more important or anything more tragic than what fentanyl is doing to the American people.
Well, thank you. I certainly agree with that, and hope that as the strategy is rolled out, that considerable thought will be given to rural parts of the country and small states like New Hampshire, which may appear positively on lots of scales with respect to income level and resources, but in fact have been very hard hit and really need help. Thank you very much.